All
All
right.
right. Great. Well, thank you all for joining. My name is Christina Ferrero. I am your Senior Customer Success Manager here at Telus Health. I've been working hand in hand with Sam, and she is fantastic. So I'm actually very excited to be here today to really talk to you about what the EAP offers you and your families as being a part of Air Liquide. So without further ado, I'll go ahead and jump in. First, I'll go ahead and show you everything what's included. And then lastly, at the end, I'll go ahead and do a brief demo of what you can see on the actual platform. And please feel free if you have any questions throughout the presentation. I want it to be conversational. But other than that, we'll go ahead and get started. I am going to share my screen now, if that's okay. One second. Okay, can everyone see my screen? Awesome. All right, so this is the Telus Health EAP orientation specifically for managers. And so first, I just want to talk to you about how you can connect with your EAP. So there's lots of different ways depending what you're comfortable with. So first, you can call us 24/7, 365 days a year, or log in using the information below. So I'm sure Sam has given you this information, but if not, feel free to even get your phones out and do the QR code here so it can bring you straight to the App Store or directly to the app where you can log in. And this is the toll-free phone number as well that you can use 24/7, 365 days a year. Then you can also visit us online at one.telushealth.com. Go ahead and click in and using your Air Liquide shared login. I went ahead and listed it here, the username and password. And you can go ahead and save this so that way once you click on the app, it's already saved so you can just seamlessly go straight into it. And then also you can use like I just mentioned, because above that is for just desktop. But this is the mobile app. As I mentioned, you can search for Telus Health in the App Store or Google Play, depending what device you have. And after downloading the app, just click login and then enter the Air Liquide login credentials. And then something to just really know going forward. I know a lot of people are unsure about this, but just please know that this is available to you and your household dependents free of charge. So there is no connection to your health plan. So just what that means is anyone that lives within your household, whether that's your parents, that is your partner, their teenage children, your spouse, they can use this free of charge as well. Is this for Canada too? I believe so. Correct, Sam? Oh, only for US. Okay.
So Canada does use Telus Health too, I believe, but they are on their own platform. So please make sure if you're in the US, please make sure to use the US information.
Awesome. So basically for an EAP, everyone thinks it's just one specific kind of things that are happening in your life. If you're depressed, things like this, but really it's anything that's going on in your life that you might just want some resources or some extra support around, whether that's feeling stressed, relationships, issues with friends, colleagues, family, looking into improve habits like such as health, or even just trying to be more physically active, personal issues like sadness or anxiety, looking to be more physically active, as I just mentioned, or really like planning for retirement, dealing with a crisis, becoming a parent, grief, money management questions, all things that really are heavy on our minds outside of the workplace. And we want you to make sure that you feel supported, you have a place to go to get additional help or resources, or just someone to specifically talk to. So this is really kind of just giving you an example of just different topics that we can go ahead and help with. And so kind of just going into the Telus Health EAP. So with your confidential we are your confidential employee assistant program. So that is what EAP stands for. And we connect you with timely expert advice and practical resources, as I mentioned, to support you with your daily questions or concerns and assist with you achieving your personal goals, whatever that might look like, because everyone is very different. And this is the different way you can access support. As I mentioned before, you can call in 24/7, 365 days a year to connect with a professional client care representative for support. And really what that looks like, so you can access immediate telephonic counseling for crisis-related situations, or depending on the relative and or specific issue, you can book in-person appointments or telephonic or video-based EAP counseling. And something important to know is you can get up to 7 EAP sessions per issue, per person, per year. And so going into what that actually is, so you can book telephonic consultations with professional experts and obtain referrals to community resources as well. So I'll go into really what that means in a couple slides. And again, you can visit us online or through our app to access well-being digital content. So let's say you're not really comfortable speaking with someone, there is self-led content that you can access yourself, such as articles, audiobooks, things like that, with the topics of family, life, health, and money. So giving more examples of how we can help. So we offer confidential professional assistance and support to help you manage all of life's complexities. As we know, especially this year, there's a lot happening. It's very heavy on our minds. And it issues with work, health, and life. So that's basically what we cover. So kind of just diving into specifically what's listed under clinical counseling. So this is personal or emotional issues, family, couples, and relationships, even work-related. Outside of the actual workplace, we can still speak to you about work situations and how to handle them better, and even anything under addiction. And then it goes into specifically work-life services. Because a lot of times if people just think EAP is just speaking about depression or anxiety, it's way more than that here at Telus Health. So under our work-life services, we offer legal consultations. So let's say you, for example, get into a car accident and you want to go ahead and take legal action of the person that maybe ran into you. You can have a free legal consultation to kind of walk you through what next steps can be taken. Same thing with financial consultations. Let's say you want to start the conversation about estate planning. You can have a free consultation with a financial advisor to kind of lead you in the right direction of how to do so. Career services. Let's say you want to kind of take the next step in your career. What should I do? Or even with some workshops in the area. You can speak with our career services panel. Same thing with family support services. Let's say you just had a child and you want to find childcare in the area. I just saw a question. Do the work-life services also have the 7 session limit? So with these, it's specifically you call in and the consultations are just one consultation. In financial advisor, it's one financial consultation. Everything under the clinical counseling, that's when you get the 7 sessions per person per issue. Hopefully I answered that question. Okay, great. But back to family support services, this is great for anything. If you're just looking for childcare in the area, they can pull the best preschools or childcare, or even if your parents now are transitioning to elder care, and you would like to find the best elder care resource in the area for you, they're going to pull the top so you can go ahead and choose which one you are comfortable with. So they kind of take that heavy lifting off you to do some research, but we give you the best in the area for you to choose from. Same thing with life work fitness. This is really just to help within the app. You can go ahead and see to help with overall health improvements and ideas to get more physically fit, and then also life coaching This kind of really helps to get better recipes and going on more walks and just ideas to help that physical health to go ahead and improve overall as well. So it's really just depending what you're looking for. It can be anything under personal or emotional issues, legal, financial, or even family support. So back to the question, Nicole, I know you just asked specifically about the 7 sessions. So this is where it comes into play. So this is where you are available to get all clinical counseling. So again, up to 7 sessions per issue, per person, per year. So each of these are different issues that you can talk to our team about. So let's say you're having relationship issues with your spouse. You can get up to 7 sessions specifically about that issue for yourself. And let's say in 3 more months, you wanted to talk to someone about specifically just maybe you're feeling anxious or depressed. That's a different issue. So you can have 7 sessions about that specific issue. So hopefully that makes sense, because I know that can be kind of a gray area. I know I wanted to understand that fully as well. So again, our clinical team is equipped to address all of these issues. There's a broad range of issues that we know people are getting impacted on, and with your family as well, especially if you have a teenager. And sometimes it's hard to get through to them yourself. We can speak to them about any of these things. If you have a spouse that's going through something with their work, or they're feeling anxious about something, or maybe addiction related, they can go ahead and speak to us. You can speak to us. Anything under work related as well. This is completely confidential. We want to really stress that. Air Liquide does not have access to anyone who calls about anything. So we always want to make that clear. But again, anything under work relationship conflicts, career planning, retirement planning, workplace violence or harassment. So again, this is something very broad. And I always like to stress as well for couples and relationships, or even family planning. So women, if you are anxious about, you're about to have a child, or postpartum depression, this is something you can absolutely access. Again, it's completely confidential. So just know it's not just one issue. It's a broad range, anything that we can help you that's impacting you or your family. Any questions here? I always like to stop and just ask. Okay. So I always like to highlight of the network of people that you're speaking to. So our network is experienced professionals. So know that all our counselors have a minimum of a master's degree in the related field and are licensed with a minimum of 5 years of EAP specific experience. So all work-life professionals are accredited and certified and are current members of a recognized professional association. So they must also have a minimum of 5 years EAP specific experience. And we also offer multiple counseling modalities and can accommodate over 200 languages and dialects through our 24/7, 365 call centers. So just know if, for example, your spouse speaks a different language or their parents that live with you do, that is completely okay. We always accommodate, as you know, we have over 200 languages as well. This is just something to tell the counselor or the team member that when you call in initially, and they can go ahead and work with you and accommodate as needed. So again, just highlighting the EAP resources, when and how you want to access us. So everyone is different of how they feel comfortable speaking with a counselor or even using Telus Health. So we accommodate with everything. So first is telephonic counseling, just over the phone. You can just speak to a counselor. It doesn't have to be in person or even video chat. Let's say you do like to do video counseling. We do offer that as well. You can strictly do this on FaceTime. You can use Skype, Zoom, chat, anything. It's really up to you of what you feel comfortable with. Or if you really feel like in-person counseling works best for you, that is absolutely available. When you call in, they actually ask you specific questions of what you're comfortable with your counselor. So you can just specify whichever way you would like to be received counseling. Or you can just do chat. I know she has a picture of her having it to her ear, but really what this means is you can just, it's like texting a friend. You can just have a chat conversation. And let's just say that you feel like that was just the best way to do it. Again, we accommodate that. And then lastly, self-directed resources. So let's just say you don't really feel like talking to someone at, having a conversation is just really not what you're ready for, and that's completely fine. I'm going to show you later on the demo of within Telus Health of where the self-directed resources are. This is more so, as I mentioned before, articles, audio listening, for example, like podcasts. There is different types of toolkits. Again, it's just really at your pace, how you want to go ahead and read different things or listen to different audio or videos you can actually watch. It really depends how you would like to go ahead and move forward with that, but that is also an option. So for managers, we always like to highlight professional consultations that are available, actually, and overall employees as well. So as I talked about previously, so these are the service categories, the legal consultations, financial consultations, and also career services. So I believe, and Sam, keep me honest, I think it's either 40 or 50 minutes that they get for one consultation per topic. So again, it's not the 7 sessions that you get for clinical counseling. This is just everyone gets one free consultation per topic. So that's just important to know. So let's say for legal consultations, you have let's say you're getting a divorce and you have a question and you take up that 40 minutes. And if you still require more time with a legal consultation, they will actually provide a resource in your area that you can actually connect with if you would like. Again, that might require a financial retainer, but they will give you resources if you would like to continue that conversation. And again, for legal, it can cover any topic overall for wills, estates, legal litigation, anything regarding a legal topic. They can absolutely speak with you about that. Same thing with financial consultations. So this can be spoken about for if you have a debt question or credit, or let's say you want to start investing, taxes, retirement, insurance, anything regarding that. This financial consultation can absolutely cover that for you. Again, if your question or conversation requires more resources, they will again give you a recommendation for someone in the area if you would like to continue on. And then career services, same thing. So counseling, career planning, even for career resilient coaching, for Medicare sign-up questions. So this isn't included with that, correct, Sam?
Sorry, run that question by me. Sorry, I was trying to pull up our agreement.
No problem. So we had a question for Medicare sign-up questions. So we aren't affiliated with that. So
no,
so
that is not included. We do have a resource. If you reach out to my HR and put a request, and we can get you that information directly. But Telus Health is not related with that.
So this is professional consultation. So going to the next one. So this is other work-life services. So again, telephonic or online. So family support services. So this is, I always like to highlight this one because some people don't really know that we offer this. So outside of the clinical counseling and the legal and financial consultations is family support services. So again, planning a family. If you are about to have a child and you need, for example, like Lamaze classes, we can find that in the area for you. And then if you are becoming a new parent and you just want more resources of what to prepare for, we can give that to you. Home support services, special needs. If you have a child or a relative that you are wanting, again, special need resources in the area, we can find that for you. Elder care, residential care, community programs, or let's just say you want to join a run club in the area, or you are wanting to do more volunteer work and you want to know the nonprofits that you can use, anything. All you do is go ahead and give your zip code and what you're looking for, and our family support team and work-life services team will help you locate the resources that you're looking for. They're fantastic. They're so nice. They've heard everything under the sun. So please do not hesitate. If you do have a question, we're always here to help as much as possible. And what I also like to highlight and really drive home more than anything in this whole presentation, if you're going to take away something, it's this: for Telus Health, confidentiality is key. It is the most important thing to us, is that no one will know you have used the EAP unless you tell them. So convenient offices for in-person appointments or online or by phone. No back-to-back appointments with others from your organization. And really always know this: with your permission, non-identifying emails or voicemails will be left. So for example, we always ask you when you call in, are we allowed to leave a voicemail or call you back? And we only do that if we are given your permission to do so. Confidential records are kept, again, and online services and programs are secure with the password protected, and it's 100% confidential within the limits of the law. So just know, because I know a lot of people feel that since this is offered by your employer, that their access to all of your records of your conversations and things like that. That is not the case here at all, only within limits of the law. So please know that anything you do speak to us about or you use the platform on, it is completely confidential and only you know how you're using the EAP. So just know that you can trust us, and confidentiality is something we take extremely seriously. We just want to be there to help you throughout the way. All right, I think we have a question, Dallas.
Can you elaborate on what do you mean by within the limits of the law?
So if there's like a legal investigation and they need to pull specific records, like if you're going to court for such and such reason, that is only when they could possibly do that, but it takes a very serious investigation to be taken, if that makes sense.
So like a warrant or a subpoena, basically?
Basically, correct. And so this is exactly what I like to talk about as well. So for managers, there is support specifically for you, because we know that there is a lot of different things that managers go through, because you are managing a team of employees that really rely on you for questions, but you also have to have a leadership way about you throughout your workday, with all different types of things that can happen. So we definitely recognize that. So we always hold manager consultations, and because we know that sometimes you may need extra assistance. So EAP professionals are available for a consultation and advice 24/7 to you. So the consultations provide the support and tools needed to sensitively and appropriately refer employees to the EAP or other suitable situations. So manager consultations can help with a broad range of different topics. For example, like an EAP professional, you're dealing with a conflict with two employees, let's say, that don't get along, and you want to go ahead and handle it in the best way. We can help with that. You want to go ahead and brush up on your leadership skills. We can absolutely give you more resources and recommendations to do so. Communicating with your team members better, building resilience and boosting morale, managing stress and overload, and managing performance, substance abuse, and mental health concerns. So let's say you identified someone on your team that maybe has a substance abuse problem, or you're understanding that someone is going through a very hard time and you do have mental health concerns for them. So how to address that, what to do afterwards, or even how to present the EAP to your employees to know that it's a safe space to go, but you want to make sure that you deliver it in the best way possible. So all of these things are included in the manager consultations. So all you would have to say is that you are a manager at Air Liquide and you're interested in speaking to someone that can help with the manager consultations, specifically with managing stress and overload for my team. And then they go ahead and schedule that. And obviously, we're here to help you as well. And then also, this is very important to know. So critical incident and trauma support. We do know unfortunately, critical incidents do happen and they are very unexpected. It's a tragic time and it's a very sensitive time within the workplace. And we always want to make sure that you guys know that we're here to help. So really, we always like to highlight what actually is a critical incident. Is an extraordinary event or a series of events which are sudden, overwhelming, and often dangerous in either to oneself or significant others. So including workplace accidents, death of a colleague, a serious terminal illness, major downsizing and restructuring, theft or robbery, bomb threat, infectious disease epidemic, and environmental disaster. So Telus Health provides debriefing and defusing to care for people after a critical or traumatic event. So just know that these resources are available if any of these examples do happen within the workplace or within one of your team members. So we are absolutely here to help if and ever this does occur. Just know that there is steps in place to make sure that we diffuse the incident and making sure that your team is taken care of. Any questions here? I always just like to pause as I know the seriousness around this. Okay. And this, we also offer a workplace referral program. So our workplace referral program provides an assessment of counseling to support employees who are experiencing performance issues at work that may be related to underlying emotional, psychological, or drug or alcohol abuse problems. So just know the manager should just work with the HR team to start this process because we do have steps in place to help as well. Now highlighting the One Telus Health online experience. So if you haven't downloaded the app, I absolutely recommend you should. It's so easy and user-friendly. We actually just redid it last year. So she has a whole new facelift. It's very easy and accessible to everyone. So just the kind of highlighting the main features. So chat or call the EAP directly through the app. Care Now, it's a self-help program that you can use. We have well-being assessments. I'll go ahead and highlight what that is later. And then also support and resources. So again, these are highlighting those self-led resources. If you don't feel comfortable yet speaking to a counselor, articles, videos, audio recordings, toolkits, and quick links. Covering all the different topics that you may need a little support on. Those are the different support and resources that are accessible through the app and on the desktop as well. And kind of highlighting what Care Now is. So this is instant support anytime, anywhere for many of life's daily challenges that we know do occur. So specialized self-help support to help you make positive behavior changes. And this is interactive with digital content that we have here and the assessments and exercises that you can actually access through the app. So kind of highlighting the range of the different programs that we offer with it. So it's anything regarding anxiety, separation or divorce, grief, depression, stress, tobacco use, communications, coping, the list goes on and on. So anything that you are feeling that you do need support on, you can go ahead and look throughout Care Now. There's a search bar there. I can actually show you when we do our brief demo, but it can actually just show you the different programs once you go ahead and type out what exactly topic you're looking to get help on. The total well-being assessment. If you're going to do anything on the app, I recommend you do this. And why I say this is because the total well-being assessment is a simple set of questionnaires based on our main 4 pillars of total well-being. So we don't like to just say that you should only focus on your mental health. That's just one piece of the pie. For your overall well-being, there's financial well-being, social well-being, physical well-being, and most importantly, your mental well-being. So what this assessment is you can complete it all at one time for a total picture of your well-being. So for example, if you tackle them individually to measure your well-being status and level of risk in key health areas, as well as your willingness and readiness to change. So once all sets are completed, you'll be given a total health score to access your overall total well-being level. So let's say you take the questionnaire for all of the 4 topics, and at the end of it, you find out that, you know what, my physical well-being is awesome. I work out, 3-4 times a week. I feel really good. However, my financial well-being and my mental well-being have a very low score. That's how it's like social media. Once the app knows what you need to focus on, it'll start to recommend articles, different toolkits to help you work on financial and mental well-being. And even for you yourself, now you know that this is something that out of the total well-being assessment that you can now work on a little bit more. So for your mental well-being, maybe start to speak with a counselor. For your financial well-being, you can maybe start to go ahead and speak with a financial consultant about, you know what, I really do need to get my taxes in order. So I'm going to go ahead and speak to them about what I need to improve on. So that it's just giving you an overall look of where you stand overall for your well-being. It's extremely helpful. And again, it's completely confidential. And it just has you have a better understanding of where you are in your well-being journey. Awesome. So before I go into a demo, I'm going to go ahead and stop presenting. Is there any questions at the moment that I can go ahead and help with? Okay. I'm going to go ahead and present again.
And Christina, while you're just pulling up your screen, I just want to remind everyone that you do not need to be tied to a medical plan to use EAP. So if you are not on the medical plan, you and your dependents, or as Christina said, anyone in your household can use this. And Air Liquide will know nothing about your counseling sessions. So thank you.
Awesome. Can everyone see my screen here? All righty, thumbs up. Love it. I love it. Okay. So again, I'm only giving this example on the desktop. Again, this will look a little bit more confined if you are using it on your app. I actually think it's even easier to use the app versus the desktop, but that's just me. So once you log in, you're going to go ahead and see the welcome screen. And it's going to say Air Liquide here, and it says find support for your health and well-being. The first thing you'll see is where it says connect with us. And this is the most important thing. You can speak to a counselor. And also what's great is you can schedule an appointment online. So let's say you're just in between meetings or you're just running for lunch. You don't have to call and speak to someone if you don't want to. It's as easy as just going onto the app and scheduling, and it takes 2 seconds without having to call someone. But let's say you want to speak to someone for support right away. It gives you the option. You can chat with them or you can call in right away. For anything emergency, just know that this is the most important thing, and it's always going to be at the home screen for easy access. And again, so this is what I was speaking about before, the featured services. So the more you use the app, the more these will be relative to what we know you are wanting and needing. It shows you the well-being assessments right away, the self-care programs. I see a question. Is there a link to this through Pulse or any other location? I'll defer to Sam.
No, so we really try to keep everything at MyAL Total Rewards, but we're also updating the dynamic document. So whenever you go to US benefits, our homepage, I guess it's on Pulse. So yes, it is on there too. And we're also having to work with communications team to get it all corrected throughout. So
awesome. So this is just always going to be featured services. Again, you can click on them. You can just continue on. And then again, featured resources. So these are always going to be just here for you to see. You don't have to click into them. It's just something of a home screen, always recommending different articles for healthy nutrition, healthy heart tips, always. And then again, kind of depending on the time of year. So again, to always encourage people to go to their annual appointments or coping with new news of tragic events. So we always try to keep it relative of current events that are happening everywhere around the world. So just know that this is what the home screen will always include. But your main topics that you're going to always use are going to be here at at the top tabs. So well-being, you can go ahead and click in that. So again, this is kind of highlighting the Care Now program that we were talking about. And it keeps asking me to do the assessment again, because we just know how important it is, because from there, it'll always recommend relevant content to you. And you'll notice every tab that you go to, it'll say connect with us. Our team is here to help you for immediate support if you ever do feel that you are needing it. And then again, the Care Now program specifically are in this tab. If you'd like to just get that self-directed help without speaking to a counselor verbally or even over the phone. And then the assessments here. So this is the total well-being assessment I was speaking about. Again, it's just a simple questionnaire. You can do start now. It's 6 questions about financial, 24 for mental, 31 for physical, and social, 38. I know it might seem like a lot, but I promise you it maybe takes 10 to 15 minutes. It's very easy. And again, 100% confidential. But the main tab, just to know where it is, it's the Life tab. This is where you're going to find all the support and resources, in the Chat tab as well if you want to get immediate access to a counselor via chat. But support and resources is where you will live throughout, I'm sure, about 90% of the time you are on the app. This is going to give you all different access to all the different broad topics that we will help you with. So again, anything family related, health, life, money, work, this is where you will find it. Again, it's always going to ask you if you want to schedule an appointment. That's very easy and seamless. You don't have to call in. You can just literally do it right here. And then it goes ahead and asks you to start to book your appointment. And from there, it kind of gives you a list of, you can choose if you would like a male or a female, if you want them to have a specific nationality, and then what time you would like to speak at, all of those things. It's literally like doing an appointment with your doctor. And then you can find the availability after you go ahead and select where you are, the different types of topics you'd like to cover. It really kind of makes it as customized as possible for the appointment that you're looking for. I always like to click into one of these. So again, anything that you're going through, whether it's becoming a parent, childcare, death or loss, older relatives, legal matters, parenting, same thing with health, addiction, health habits, mental health, children, physical health, seniors, or life. There's a crisis, home and moving, personal relationships, diversity, and even personal issues. So let's just, for example, say that we want to go ahead and do personal relationships. It gives you, again, just different topics that you can just kind of click into. Let's say communication is one that you're really wanting to work on at the moment. It gives you examples of different featured articles that you can click into. There's even a podcast you can listen to. You can just scroll through if you'd like. If like maybe you're like, meh, I'm not really wanting to talk about burnout. It's more so, burnout in my relationship. So you can go ahead and click on this. And then it gives you a good article and just resources and just recommendations to kind of maybe make the topic a little bit better. And then it always recommends another one that if you like this article, it gives you another recommendation of others, and then related articles at the bottom. So again, it's a wide range of different type of topics, depending what you're looking for. You can always just go back to the life section and say, you know what, I really just want to, since tax season's coming up, I need to talk to someone about money management, budgeting, debt, savings. Again, there's all different types of topics you can access here. They're all different articles, and as well with videos and different infographics. There's even audio and different videos that you can actually listen to. Let's say you just want to go on a walk and you don't feel like reading anymore. You can put this on as you walk or work out as well. Jeff, okay, there are several Telus mobile apps. Which one? So it's going to say Telus One. And then I can actually also send the QR code that I just had here. Let's see. Okay, am I still sharing? 1 second. I always like to do this with everyone. If everyone wants to go ahead and take a couple minutes, you can just hold your phone to the screen and the app should just pop right on up. And then from there, you can add your login credentials that Sam went ahead and listed in the chat. And once you guys are done, let me know, and then we can carry on as well. All right. Jeff, did that work for you? Everyone else?
Yes, thank you.
No problem. I know everyone probably has their phone right on their desk next to their keyboard. So, perfect. Oh, didn't mean to do that. I'm going to go ahead and just jump back into the demo.
We have a question from
Okay.
Jennifer, if we want to take a question real fast.
Yeah, absolutely. Go ahead, Jennifer.
Thanks. Just a quick question. Did you say there was special sign-in information for this? I missed that part.
There is a username and password. I think Sam posted it previously. Let's see.
I might have missed it because I joined a little bit late. Sorry
No
about that.
problem. No problem. I can go ahead.
So I put the username and password in the chat.
It was
Also,
on that last screen you showed.
I did
Okay.
pin this. So on the My AL Total Rewards, the password and username is on there. You do not need to be on the internet. So if you don't have access to Pulse, you can go there. And all the information is there.
Perfect. Thank you.
Okay. No problem. All right. So we can go back to. No question is a bad question. This is exactly what this is for. Okay, perfect. All right. So again, just kind of showing that there's all different types of resources here. There's no off limits topic. We have a ton of, again, different ways that you can access it. The articles, the quick links, there's Podcast Hub. This is actually great. I love sometimes I'm not in the mood to read sometimes, and I just want to go outside and go for a walk. I can listen to the different podcasts that we have available here if you're into that. Again, and then we have different, personal development videos. If you really like videos and feeling like that's something that you're more into. Or again, you want to go ahead and search for childcare or an elder care locator. This is where you can go ahead and do that. And then it offers more featured videos for healthy, active living, holiday budgeting, juggling responsibilities. Again, more featured audio listening options. So the list really goes on and on. But like I mentioned before, if you're really going to do anything first, once you log into the app, I would absolutely recommend doing the assessments in the well-being tab. That way, when you log into the app, it's going to be an even more customized and personalized experience for you, because then it will understand really, maybe you are really looking into more healthy habits and maybe financial tips. It's going to always then recommend those types of content options to you, and so on and so forth. And that's really honestly everything. I know I have a few minutes to spare, but just wanted to see if there's any other questions, comments that I can help with in the meantime.
So there was one question in the chat from a person, Bella. The app asks to create a personal account to save our results. Do we need to do that?
Yes, you can. That's going to just be sent to your personal email if you would like. And again, we only do that for confidentiality reasons. So completely up to you if you want to take it that far. I've done it. It's very easy. So it's just an option.
Okay, thank you for clarifying.
Yeah, no problem.
Okay.
Any other questions? Oh, Kristen?
Yeah, probably, and I apologize if you already covered this for the, I think it was called like trauma and crisis for that category. Do we have the option of sending someone to this site? Yes. And how would we go about organizing that?
So Christina, our HR business partners and directors, whenever we have a crisis on site, getting a counselor to that location, we do have that option. For the HR team on there, I'll actually get that information to y'all directly. So I'll work with Christina to make sure y'all have that information should a crisis happen.
Okay.
Absolutely. Our critical instance team is fantastic. So just know that you're in good hands if and ever there's something that goes on. So absolutely. Okay, I think Tim.
Tim, no, Teladoc is different. So that is through the Aetna plan. And this is for all employees. So no, it is not replacing Teladoc Health. That is I want to say in addition to, but it's actually replacing Resources for Living, not Teladoc. We still have Teladoc. I believe EAP is available. So the mental health services are provided, but they do charge per appointment. So that goes towards your insurance, and it is paid by the employee. Telus Health will get you the 7 free sessions per issue per year per member. I hope that helped, Tim.
All right. That's actually a good question. We do get that often. So it's very similar, the names. So we do apologize. We wish it was completely different. So great question. Anything else?
What information do we need to? So do they need to provide any information for their dependents when they are receiving support?
Nope. So the good thing about when the login information that you have and also the phone number, they do know that it is specifically for Air Liquide. So all they have to say is that they live within the household of you as the employee, because that way our team goes ahead and cross checks that they are a member or employee of Air Liquide to then them be able to receive services. So whether that's your email or any kind of credentials that they can identify you as a working employee of Air Liquide, that's all they would need to know. Great question.
Mm-hmm. So if no one else has any questions, feel free to log off. But Christine and I will stay online for maybe a few minutes more for those who have additional questions. But everyone have a safe day. I will be getting this recording out along with the slides. And for the HR business partners, I'll make sure that y'all receive the critical incident report so you can get on-site care for our employees. Oh, we have a question.
Hi, Philip.
Oh, I apologize. I clicked the wrong button. So
no, it's okay.
good presentation. Thank you.
Thank you all so much for joining. And again, yeah, I'll hang out for anyone that has any other specific questions, but it was great meeting you. Hi, Lisa.
Lisa, you might be on mute.
Nope.
Or maybe she pressed the wrong button too.
That's okay. She says, sorry, I am. Okay.
Jennifer.
Hi, just a quick question, and I might have missed this at the beginning, sorry.
No, it's
But
okay.
is there going to be any sort of, I guess, communication coming out from HR on this type of service that's available for all the employees so that as managers, we can coordinate, like communicating with our teams?
So all of this information was actually sent out throughout open enrollment. So there was a pretty big push, but we can most certainly do another one if it's well needed.
Okay. No, I just wasn't sure. I think what I'm going to end up doing is taking your presentation and maybe just kind of throwing it up on one of our weekly team meetings just to remind people that it's out there.
Yeah, that'd be great. And just to that, the link that I sent with the My AL Total Rewards, it can be sent to spouses and dependents that are not Air Liquide employees. So they have the information without having to be on an Air Liquide site. So
Perfect. Thank you.
sure.
Thanks, Jennifer.
Lisa.
Lisa, are you on mute by chance?
She's not, but I don't know if it's connected. Oh no.
Oh, no. Or feel free to write your question in the chat.
It puts you on mute. Oh, do you mind just putting your question in the chat then, Lisa? All right, while Lisa gets her question put in, does anyone else have any questions? I missed the login information. Okay, so I will, it's the link, everything you can find is at my, right here. So all of the information for login and how to get into the site is listed on that website.
Awesome. And Sam, you have the flyers that can be able to be sent out as well, correct?
Yes.
Let me know if you ever need anything specifically for any type of specific like issue. We can always do customized ones for you guys if you ever need it.
Yes. We'll probably do that during May because that's kind of the mental health month.
Oh, absolutely. We are locked and loaded with anything you need.
All right. Well, since the questions have kind of slowed, everyone have a great day. If you have any questions, of course, you can reach out through the My HR request, and everyone have a great day. Thank you so much, Christina.
Absolutely. Thanks so much, everybody. Have a great day. Bye.
Bye.